A transthoracic echocardiogram, TTE, is the most common type of echocardiogram, which is a still or moving image of the internal parts of the heart using ultrasound. In this case, the probe, or ultrasonic transducer, is placed on the chest or abdomen of the subject to get various views of the heart. It is used as a non-invasive assessment of the overall health of the heart, including a patient's heart valves and degree of heart muscle contraction, an indicator of the ejection fraction. The images are displayed on a monitor for real-time viewing and then recorded. Details. An echocardiogram can be used to evaluate all four chambers of the heart. It can determine the strength of the heart, the condition of the heart valves, the lining of the heart, the endocardium, and the aorta. It can be used to detect a heart attack, enlargement or hypertrophy of the heart and infiltration of the heart from an abnormal substance. Weakness of the heart, cardiac tumors, and a variety of other findings can be diagnosed with an echocardiogram. With advanced measurements of the movement of the tissue with time, tissue Doppler, it can measure diastolic function, fluid status, and ventricular dyssynchrony. TTE in adults is also of limited use for the structures at the back of the heart, such as the left atrial appendage. Transesophagealechocardiography may be more accurate than TTE because it excludes the variables previously mentioned and allows closer visualization of common sites for vegetations and other abnormalities. Transesophagealechocardiography also affords better visualization of prosthetic heart valves and clots within the four chambers of the heart. This type of echocardiogram may be a better option for patients with thick chests, abnormal chest walls, chronic obstructive pulmonary disease and the obese. Bubble contrast TTE involves the injection of agitated saline into a vein, followed by an echocardiographic study. The bubbles are initially detected in the right atrium and right ventricle. If bubbles appear in the left heart, this may indicate a shunt, such as a patent foramen ovale, atrial septal defect, ventricular septal defect or arteriovenous malformations in the lungs. If your doctor deems it necessary, a stress TTE may be performed. This can be accomplished by either exercising on a bike or treadmill, or by medicine given through and for along with a contrast agent to make your bodily fluids show up brighter. This allows a comparison between your heart at rest and your heart when it is beating at a faster rate. Transthoracic echocardiogram, ND. There are some risks associated when having an echocardiogram performed. It is possible that the images will not show up clearly enough, which can cause a misdiagnosis. This type of echocardiogram can also miss certain parts of the heart that cannot be captured. Some things you can do to keep your heart healthy: exercise, stop smoking, keep current medical conditions under control and eat foods that will keep your heart healthy. This can be accomplished by limiting foods that are high in fat and salt and eating fruits and vegetables as advised by your doctor.
Please subscribe and thanks for watching.